Hello, everybody. Good afternoon here in Brazil. My name is Mayara. I'm a medical student from Brazil, and today we are starting our third family medicine rural cafe, and I'm very happy with the theme today. The theme will be social media, or as we are talking about it on the Twitter and Facebook as some. And today we have a lot of new people here, so I would like to everybody to introduce yourself. We will have some people that will bring your insights on Twitter, and we have Veronica that is facilitating it on Twitter, and on Facebook we have Amber that is facilitating it. So we have a very interactive rural cafe today, so I'm very happy. And who would like to start? Amber?
Shall I start then?
Yeah, that's fine.
So hello, my name is Amber Wheatley. I'm a third-year medical student at Swansea University, and my interest in rural medicine, I work with the university in a program called the Rural and Remote Health and Medical Education, which focuses on general practice and tertiary care in rural and remote settings.
Hello.
Hi, Joseph just arrived.
Yeah, sorry.
Yeah, you can introduce yourself, Joseph. You are just introducing ourselves. I just introduced
Right.
the them of today.
Okay, my name is Josep Vidal Alavall. I'm a rural GP from Catalonia. I work in the north of Catalonia near the Pyrenees. And I'm a member of Euripa and Wonker.
Hi, Joseph. I think Joseph just stopped it, freeze it. Again, Joseph, are you back?
Yes.
Okay, so we stopped the transmission on Euripa.
Yes.
Okay, so do you like to say anything more?
Well, not really, just very quick.
Okay. So who is the next? Dr. Pratyush?
So hi everyone, I'm Dr. Pratyush from India. I'm a family medicine. I'm just doing my DNB family medicine and currently now in third year. And I've been also given the responsibility to make a Wonka's rural health group in South Asia region, which I am currently working on. And I've got deep passion in rural health. And currently I am doing some research work on rural health and with the use of social media. So looking forward to our interactions. Thank you.
Okay. And Sarah?
Thanks, Myra. I'm Sarah Strasser, and I am a rural family physician. I was just thinking about the fact that I've worked in the UK, Australia, and I'm now based in Canada, and also doing some work in Guyana in South America. And I've seen the whole development of social media, and I was just thinking back to the fact that when I was a child, I used to travel with my grandfather doing house calls in Cornwall in the UK. And I would sit without a seatbelt, I have to say, on the armrest while he drove the car, and would go visiting his farming patients. And during those periods of time, of course, he was totally uncontactable by anyone. And so they were it was a very special time in some ways for me with my grandfather. I'm quite sure that he was the key reason that I went into rural general practice. But how times have changed, you know, and how contactable we are at every single possible moment. And of course, I'm the worst. I completely forget to turn my phone on or turn my phone off, and it goes off at the worst possible times, and I get ticked off by the flight attendants because all my gadgets are still on. So I am not a good advocate for social media in terms of I have no idea really how to use it efficiently and effectively. But on the other hand, have seen the rapid way it has changed the face of medicine. So I think it's very exciting, because my belief and hope is that that social media is really about will have the biggest impact in changing rural family medicine by reducing the professional isolation and having opportunities to chat like this with colleagues, and feeling connected and that you're not the only one out there is a very important thing to address. So I'm looking forward to this session in particular, thinking that I'm going to learn a lot more that I'm going to be able to pass comment on. So if I'm very silent, forgive me, but it's appropriate. Thank you.
Okay, and Luis?
Thank you, Mayara. My name is Luis Costa, and I'm a third-year family medicine trainee in Oporto, Portugal. And I'm also a member of Vasco da Gama movement. So I'm currently the liaison for the image group, and the image group deals with the promotion of the Vasco da Gama movement. Vasco da Gama is the network for new and future family physicians in Europe. And so social media is quite important for that promotion, and I think that's why I'm here today, and the reason for you to inviting me.
Okay, and finally, Veronica, our Twitter facilitator.
Hi everyone. So my name's Veronica. I'm a family medicine resident from Croatia. I will be facilitating the Twitter chat today, so I'll be a silent participant. I'm also a member of the RIPA executive and of Vasco da Gama. I'm the Beyond Europe liaison, and currently I'm working on establishing a global group for students and young doctors in coordination with the Wonka Working Party for Rural Practice. So I'm looking forward to hearing what you all have to say about this.
Okay, and Bianca just arrived. Bianca, can you introduce yourself? I think she's still setting up. So I will start. Veronica set some questions for us to start, and I think it will be great for us. She brought a lot of new ideas, and I think that is interesting. So I would like just to put one on the table for us to talk. So what do you think, and how could social media be used to improve patient care in rural areas? So what do you think? Who would like to talk?
Yeah.
Dr. Pratyush, okay.
Yeah. First looking at Indian scenario, this internet penetration of internet in the rural areas is still not so high. But if you look at the stats of the internet, we have got 305 million people using internet, and more than 50% are using it by their smartphones. So what the social media can help is the upper middle and upper classes of people. It can severely help, and with the use of social media we can create awareness. With the there are many social health programs are there, many rural programs are there, which can be potentiated by the social media. And social media can help in making organization and promoting the organization, because suppose we are creating a rural health group. So by use of social media we can tell more people that look, there is some group called rural health group, and it works for rural people, and so that people can contact in case of need. They can contact us. And there is also something called patient care. Suppose we are prescribing any medicines, and they want to know what the medicine is all about, and how does it works, when to take the medicine, when not to take, what are the side effects. There are various questions of the patient, which questions we can answer through social media. And just like FAQs, they are frequently asked questions. These questions can be solved by the social medias. And then comes the patient education. There are something content blocks like Wikipedia are there. on the same format there can be blogs which is written in patient friendly language, not in the medical terms, which we can make blogs on common health diseases and their symptoms, so that it may help patient in knowing about their condition well. And then about the professional networking which we can do by the social media. We can create the network just like how we are chatting, some 7 of us, 8 of us, we are chatting from all over the world and knowing about each other's and how the rural health is there in their part of the country. This is how I think social media can help. And the next is the research part of things. Currently, I am doing some research which called as knowledge, attitude, and practice surveys. These surveys can easily be done through social media, which I'm currently doing with the help of Facebook and WhatsApp. What I do is I make a Google survey form. There's Google survey form is there, by which you can make the questionnaires and you can send it across all the age groups. Recently, we had a H1N1 outbreak. It's a big outbreak there in India, and just last month we had a big dengue outbreak. So we used this Google Forms and we circulated among the patients. All the patients who were coming to our OPDs, we used to send them the link of Google Forms to their WhatsApp number. And indirectly, it used to create awareness. By answering the questions, they came to know about what are the precautions, what are the breeding time of mosquitoes, what are the danger signs of dengue fever, and they became more aware. So these all are things I think social media can help us. Thank you.
Okay, so just to introduce Bianca, she just entered now. Bianca, just introduce yourself.
Okay, hi guys. I'm so sorry about this mess. I was used to use my cell phone and I was trying to use my computer now and I was completely lost. I'm so sorry. I was already listening to you all. I was already listening to you yourselves, introducing yourselves, because I was just watching, but I couldn't enter into the conversation. Briefly, my name is Bianca. I'm from Brazil, from the south of Brazil. I am a medical student. I'm in my third year, and that's it. I don't know.
Okay, Bianca. So we are just talking about how could some our social media be used to improve patient care in rural areas. I just asked for who is without the mic off. Please just turn off because it's coming the sounds. So who would like how we could use it to improve patient care? Dr. Pradesh just said about his experience, and what do you think, guys?
Well,
No one?
I can add a few.
Okay.
So I think there are at least 3 main areas where social media can be used in rural areas, but also in urban areas. But rural areas are will benefit the most from this. So I'm thinking about access to health information, namely in terms of health promotion and disease prevention. So access to this kind of information that is readily available online in social media is for sure one thing that we should think about when talking about using social media in rural areas. But also access to practical information in regards of the practices. So for the patients to know when are the GPs available in the practice that he or she goes to, when are the flu shots available at the practice, for instance, when the time comes. And also to build patient communities, so for patients to be able to find other patients battling the same ailments, the same diseases, because when we are talking about rural areas, well, in many of these areas they come with isolation, and that comes for doctors but also for patients. And it might be very important for a patient to get acquainted with other people with the same disease and be able to share advice and just talk about it. So I think these are three main areas where social media can be used in rural settings.
Yeah, I agree with you, Luis, because I think it's a really good instrument for health literacy, and this is really nice. And also for updating ourselves. I discovered Twitter actually with Veronica and Rock on the Wonka Rural this year actually on Croatia. And they said, really, you need to have a Twitter. And then I said, well, why? And they said, because everybody has one and every doctor needs to has one to be updated and learning and these kind of things. So I did my one. I'm not the best user, but it's kind of interesting when they go through and check what's going on and updates and everything. And I think the patients have the chance to have this literacy as well. But we need to question as well. I think like not everybody can access this. As Pradyush said, it's just like upper middle class, and like we don't have these hangouts for everybody or even all. So what we can bring of this in just to question more and bring to this discussion as well the access to this social media and how we can make it go for people that are not that doesn't have contact with computers or internet even. So what do you think, guys?
Can I just ask a question or like introduce a topic for discussion, I guess? Because one issue that will arise with using social media is about patient confidentiality. It's very nice for patients to be able to find someone else who has a similar condition or get information from doctors about it. But we all know that the internet isn't exactly a safe place to put your personal information. So will medical information be then treated on social media is what I'm trying to ask.
Anyone would like to answer it? It's nice that this week I was reading about it. Like we should add some patient that is our friend on Facebook or not, and this kind of social medias that come to our day-by-day work and practice, and it's kind of hard sometimes to separate your personal life on social media of your professional life as well. So who would like to talk? Joseph, Luis, say, make a sign.
Yeah.
Personally, I
Okay.
Go ahead.
I don't have any of my passions to my Facebook page personally. I wouldn't mind if they want to follow me on Twitter because I tweet about medicine, but on Facebook or on Instagram is kind of personal, so I wouldn't add any passions. Although I have started doing a Facebook page just for passions, so trying to separate one thing to the other. But well, it's just something I'm doing now. But on Facebook, I try to keep it separate. So when I started using social media, I thought about how I wanted to use each of the different social media types. So I decided to use Facebook for personal, family reasons, and then use Twitter for kind of medicine, general practice.
It's interesting. Dr. Ewing just arrived. Hi.
Hi, how are you? Thanks for hosting me. I've been watching, but I just finally worked out how to connect. I'm talking. It's very early in Australia. Talking about social media, we use it a lot, or certainly I do. Use Twitter mainly for communicating with both patients, but particularly as a representative of rural doctors, use a lot of Twitter to engage with politicians and with media people to both have conversations about social media, about important issues for rural doctors and for rural patients, but also to get public health messages out quite quickly. So we use social media as a very responsive way of talking to people, both in policy, in government, in the media, and with patients.
Okay. And what do you think about the confidentiality of the social media that we were discussing?
Yes, I might have missed that. Confidentiality is always a problem, and I always go by the premise that you shouldn't say anything on social media that you wouldn't say in a lift or in the middle of a public place. That confidentiality is something that you must be always aware of, and you can get into much trouble if you obviously talk about identifiable details or people be able to be identified through their clinical problems. So yes, it's important, but it's a very simple thing. You don't say anything that you wouldn't wish to appear on the front page of the local newspaper.
That's a good advice. And Luis, would like to talk now?
Yeah, it was just like Ewan said, just treat social media as you would treat media or your grandmother. Don't say anything that your grandmother wouldn't be proud of you to say. There are guidelines that can help also. I think the Royal Australian College has some guidelines on this. The British Royal College, the College of General Practice, also has some guidelines, and there are some American guidelines as well. So these are things that you should actually read and learn from before actually delving into social media. And I would also like to address the issue around the access to internet. And we should be aware that 1 in 7 people are already on social media, so 1 billion people are already using it. And companies like Google and Facebook are actually lobbying for universal internet access. So you might have heard of Google balloons and even Facebook drones. So there are these initiatives already in place that are meant to deliver internet across the globe to every single one. So I think access in the medium and long term won't be a problem. And that's something very powerful as well.
Just to add a bit of what you said, Luis, I'm not sure if it will not be a problem because here in Brazil, not all the people can. Well, not all the people can have electricity. So how are you going to have? Yeah, I'm not sure. I think the Dr. Pradyush have maybe a reality like us, like we are a third world country. But yeah.
Yeah, but countries like Brazil and India are the main, the places where smartphones, so low-cost smartphones, are really getting really well a boom. So I think these things will get to the people, no matter what.
Yeah. Well, and what do you think? Do you think that the rural area have the same access of an urban area? Who would like to talk?
Well, and I think
Yeah.
apart from the I think there is also kind of a age issue here because at least in our rural areas, usually it's more older population. So usually, at least in our areas, they have less access or they have less interest on social media. So I don't know, maybe it's not just the access, also it's the attitude or the need to use social media.
Just to bring an example, I have part of my family live in the rural area, and they are trying to have internet access and even cell phone access since I don't know, since 2010 that they asked for having there, and today is almost 2016 and they still without it. So they have just electricity. I have cousins there that need to travel to the city to even do a call and to even have internet access. So I think it's not for everybody yet, and it's far away. So I don't know if anyone have this kind of experience or would like to bring it.
Sorry, can I?
Yeah.
First of all, I would like to ask to Luis if he could give us the link of that guidelines that he said before, because I didn't know about it. I'm really glad to know about it now, and I really would like to read it. And yes, I believe that here in Brazil, our main problem about internet is about signal. It's really hard for us if you go to rural areas. It's really hard to have signal, so only in urban areas you can have it. So yeah, I know lots of people who live in rural areas and they have lots of trouble with it. So I agree with Mayara in this point, but at the same time, I didn't know about this data of 1 in 7. So we have 1 billion people using internet. This is a huge number. I didn't know that. So yeah, actually, I don't have a Twitter. I think I have to do one as well. Maybe it's time to do it.
Okay. So anyone would like to bring any other thing?
Yeah, hello. Actually, I am from a rural area, and in our place, the problem is that the fastest speed of internet, which is called 3G or 4G, is not available there. So you can't do a Google Hangout from from our village. You can get the access to internet, but it's so slow that you can't get more information, and it's very irritating for people to go to social media for some information on healthcare. It's better to go to a person and then gather information than to go to a social media in a very rural area where the fastest speed of internet is not available. But the other problem, which is more important to discuss, is that whatever information is which is there on social media, are they all authentic? Are they all valid? This is the most important, because most of the people, those who are using internet, may not be getting the correct information for their problems. Nowadays, what's happening is that before coming to a doctor, the patient is going to Google their own symptoms, and they're going to make up their own diagnosis by just going to Google, and they come up with their own makeup of mind, and they start discussing with the doctor, and just wasting a doctor's time, not listening to what doctors want to convey. They stick to what they have learned from the Google. Google has become their main doctor, and the other physician to whom they have come for treatment, they have become a secondary doctor. So this is the thing, that we should look for some authentic and verified, just like Twitter has brought the verified signal, that look, this is the verified, because so many people have started copying the big shots, big celebrities, that they've brought a verified signal to their names. Similarly, in the social media also, we need, especially for healthcare, because it's related to someone's life, we should have some verified and authentic information on the net, and it will help the patients more to get information, and they will have, when they'll get authentic information, their trust will also increase in the social media. Otherwise, somewhere it may go to lose down in the long run. Thank you.
Okay. Yeah, I think this is nice to say that you say, Dr. Pradyush, because I think we need now to have a social medicine competence in communication with patients, and we need to start to discuss this competence, or having these issues on our consultory, and having these things to discuss on with our patients. I think it's a new way of bringing things. And I think Dr. Ewing McPhee have something to add.
Thank you. I think there was a few things to say. The first is that mobile phone penetration in some of our less developed countries is possibly much greater than we think, and certainly in times of disaster it becomes quite clear that the penetration of mobile phones and social media platforms such as Facebook can be quite great. So with the disaster in Haiti, over 80% of people had a Twitter account, and the Twitter accounts were used as a method of as a radar, I suppose, for looking at trouble spots where health intervention was required, and people could use the Twitter accounts and the Twitter messages as to identify places that required emergency support. The example, I guess, from Nepal, where over 80% of people have a Facebook page, and you start to really think about how you can deliver emergency and priority public health messages through a social media account. And I think that what I think was important for us to consider is almost a stock take, if we could, of where we perhaps underestimate the penetration of social media. In Malaysia, Indonesia, they're looking at creating micro businesses by giving women access to mobile phone accounts and to social media accounts, where women can run their own small businesses by access to a mobile phone. Certainly, even in countries like China, I understand there's an investment in broadband, and where you've got mining, the erection of mobile phone towers. So the penetration of these technologies can be very, very variable over the country, over the world. So I think it's always interesting to think about how we get a finger on that, or a finger on the pulse of the penetration of social media and mobile phone technology into our very rural, very isolated areas, because it's quite variable all over the world. And it's something that interests me as to how you get those public health messages and engagement out there. And there's some really good examples of where it's worked quite effectively.
Okay. And Amber, what do you like to add?
So there are two things that I want to discuss, really. Going down to the issue of patients coming in with information that they have from Google. One of the things that my university has focused a lot on is something we call ICE. So it's ideas, concerns, and expectations of the patient. And because the consultation in the UK only has 10 to 12 minutes per patient, what you do is the patient comes in with their Google printout or whatever, and you kind of use that to relate what their ideas of what they have is and what their main concern is, and you then build their consultation around that. So although it take a bit of time sometimes, if the patient is like completely on the wrong track, sometimes they can actually help you, because then you know what it is that they're worried about and can tailor the consultation to what their main concern is. The idea of using social media for social campaigning, I really like that idea, especially because in the Caribbean we have a lot of HIV/AIDS, and recently the HIV/AIDS department in our health industry has used Facebook and Twitter to try and publicize people getting tested. What that does is it reduces the stigma that you have, because often associate HIV/AIDS with poverty and lack of education and so on. But the people who have social media are often the opposite of that. And so by using social media to raise awareness of HIV and AIDS, you're actually showing people that it can happen to anyone, so everyone should get tested. So I do agree that it's a very good media, and it helps kind of personalize and humanize the issue rather than making it about statistics. Okay, thank you.
Yes, I just want to introduce another thing is about asking questions, and something I have started doing recently after I had a tweet chat with e-patients, because as you say, most of the patients, they have looked at the internet before coming to the doctors, but sometimes you don't know, and you don't know what wrong information they have got from the internet. So I'm trying to do is asking them actively, asking what have they looked at the internet about their conditions. So at least I know what they think about that, and I'm a bit more prepared to answer their issues and their worries. So I think it's a good point just to try to ask them what have they looked about their illnesses on the internet.
I can add a comment. And that, I mean, this is nothing new, I have to tell you, because patients will come in convinced because Aunt Sally has told them something or their grandmother has told them something, and they will carry that conviction with as great a strength as whether they've read it through social media as opposed to getting it from their own little local social network. So it's a skill that you have to develop regardless. I guess what I was thinking about social media and what I'd like to know from the group is how do you feel it can support you in what you're doing? And I was fortunate to go to the Towards Unity for Health conference in South Africa in September. And we went on one of the outreach visits organised through the conference. And I went to Mamelodi. And I might not have pronounced that quite correctly, so I apologise if I haven't. But anyway, the most phenomenal things we were seeing there, and certainly social media was helping, was that people in the community were identified as community workers and representatives, and then they would be given an area that they were responsible for. And I mean by that they were responsible for gathering the health information on all the individuals that lived within that area, and they would spend every day going around knocking on doors of houses, talking to the people who lived in them, and getting details down, being able to do things like blood pressures and checking out who was well, ill, and I just feel that the benefit to me of social media is not only providing the health professional support so that these community workers were able to link with other community workers and ask for further information if necessary, but they were also feeding the information in so that the data was about health in these rural areas that were remote and not visited by doctors on a routine basis or any health professional. The social media attractiveness to me is just this huge possibility of connecting people and you know, just in a way that individual people or even groups of people just can no longer do. I mean, not that they ever could, but they can't do, whereas I think that social media does this. And I've certainly heard about how other people are using crowdsourcing to contribute to research, and so I think that that's connected with this kind of area that I'm interested in, and so I wondered if anyone had any thoughts about that and whether they're using it in that way. Thank you.
Just before I answer that, Sarah, just let me answer some topics that were left behind. So, Bianca, I've posted on Twitter on the hashtag Rural Café links to the guidelines that I mentioned earlier, including the VDGM social media compass that the Vascular Government Movement released some weeks ago. And that is meant to empower family doctors to use social media proficiently and skillfully. Also on patients Googling about health information. I think that's a sign of a patient being engaged with their health trying to be empowered, and we shouldn't disencourage that. Every time a patient comes in and says that has Googled something and he is dying, okay, let's not disencourage that, because it's a sign that the patient wants to learn something about his or her health, and we should take that in and embrace that. About Sarah's question on how social media can be used for doctors, and I agree that professional networking it's a main topic, a main focus for social media, and there are a lot of different examples of this. The social media compass that I mentioned earlier also has really nice examples of this. So the compass is a tool developed by Vasta Gama, and is built around stories and cases, real life stories. So I think Ewan McPhee has his story there, and many others share their stories and how they are using social media to actually, get to the patients, get to their peers, and use it in a professional manner. So there are a lot of perfect examples of this in that compass, and I think by reading those examples, we might find inspiration to do more and use social media in such ways. Also, learning from peers. Well, we can crowdsource this filtering of information to our followers on Twitter, to our Facebook friends, etc. So that's a way to keep ourselves updated without going through all the literature that is published every day. So it's impossible to read all that, but our Facebook friends and our Twitter followers will do such work for us, and just read. Well, we'll be able to read just the things that are most important, and also participating in events. I mean, I've participated in conferences all across the globe just on Twitter and tweet chat and so on. So that's perfect.
It's Ewan here. I guess if I could just make a couple of comments. The first one is about setting a professional identity. When we have patients come and see us now, certainly in Australia, often the patients will have done some research online, not just about their condition, but about their doctor. So that if a doctor has a social media profile, and you can set a profile through things like LinkedIn, through Twitter and Facebook, the patient will have some idea of your interests, your abilities, the things that you might be able to offer them. And more people are researching their GP before they go and see them. So it's really important, I think, that doctors, family doctors, rural doctors, understand what their own social media profile really looks like. It's very important, because if you have a good profile, people will, and it's an opportunity for you to put out there what your interests are, and what organisations you belong to, so people have some understanding of who you are and what you do. I think that's important to recognise, that people research their doctor just as much as their condition these days. You have to be careful again about confidentiality and about advertising, and some countries have very strong rules about advertising, and in Australia, Twitter, Facebook, LinkedIn, and the use of testimonials or even positive comments about you on a Facebook page are seen as advertising, so you have to be very careful not to breach the advertising guidelines and other guidelines of your own regulation authorities. I think it's important to be aware of that. The second issue around crowdsourcing is that of medical education, and I'll put up a link to Life in the Fast Lane, which is a website that's run by an emergency medicine physician. We have a new term called FOMED, or Free Open Access Medical Education, which I guess is a crowdsourcing of medical knowledge using your peers and some experts to rapidly get medical knowledge. And I think this is another exciting aspect of social media for particularly rural and isolated doctors, is that they can get up-to-date specialist information using fairly rapid technologies such as Twitter to talk with experts who may be online. So just a couple of comments, both about personal, professional profile and about crowdsourcing medical education.
Okay, it's really good comment, Erin. Thank you. I just wondering, I'm just like getting more through this Twitter and Facebook and everything like this, and I'm just wondering if you have any tip, because for me sometimes it's hard to manage my WhatsApp, and then I have 8 messages on groups on WhatsApp, and then I need to see my Twitter, check my Twitter, and then I need to check my Facebook, and I have a lot of messages, and I need to check my email, and how it's not flowed in all this social media information, and how do you manage? Do anyone have any tip? Sometimes I'm so tired that I couldn't manage it. I think Joseph made a face there who has any tip.
Well, what I do is I just, when I arrive at my consultation, I just mute my telephone, I just put on a drawer, and I just forget about the telephone until I finish all my consultations. Is the only way, because if not, you know, I wouldn't be concentrated enough to see the patients. Then the afternoon when I finish them, I open it and I deal with what is there.
Okay. And Amber, do you have anything from Facebook?
Yes, so there's a girl called Smriti, I think from India. So she said on the use of social media, it helped her to connect to all of her friends. So whenever they have an interesting case, they share it, or whenever they have doubt about what they need to do, they share it. And she also said about patients Googling their concerns that it's okay because everyone has curiosity, but sometimes the patient can lose faith in the doctor, especially if they're researching the doctor and they don't really like what they see on their social media. They lose faith in the doctor and then they want to treat themselves. And she said that's where you can get into a lot of trouble and complicate the issue. So I think, yeah, some tips on what's the best thing to do for social media would be very interesting.
Anyone would like to talk?
Yeah, hello. Just I wanted to bring one small story which recently happened. I don't know many of you know or not. That this person committed suicide just because he knew that his symptoms resemble that of AIDS. He's just Googled his symptoms on the internet, and he found that his symptoms matched that of AIDS, and he committed suicide just because of AIDS, because of the stigma of AIDS. This is the one of the drawbacks of social media, which can a person can get into, the worst drawback of social media. So that we should have something which is called authentic information on that, and we should encourage patients to consult doctors personally if they have got some problems, and they can use social media just to get themselves more aware about the disease process. That's all I have to say.
Yeah, what you're mentioning is actually one of the reasons doctors should actually be using social media. That's because we need to make available accurate information and redirect our patients to information that we believe it's most accurate. So by opting out of social media, doctors are actually turning their backs to their patients. We need to be there because patients are there and they are waiting for us and they expect us to be there. And so we have to be there for them and directing them for the right information.
Okay, Sarah would like to say something?
Thanks, Merit. Well, Louis, that is the strongest indication for me to go and get on social media, so watch out, everybody. I guess what I'm thinking is that there is this big push worldwide, and I think it was you, Ewan, who mentioned that, but I might be wrong, that Google trying to provide access everywhere. I mean, I just wonder if we could, perhaps as part of the rural faculty, identify all the benefits for the social media in rural health, and then actually put the challenge to Google and Facebook and whoever else that really actually they do need to make sure that it is available and reasonable bandwidth worldwide, because otherwise they're just perpetuating the have and the have-nots issue. And what we know about that is that the gap keeps getting bigger rather than reducing. So that this would be a very positive contribution to the world. And I think that we could get a very strong message advocating for appropriate coverage, bandwidth, and then usage, and put out guidelines, perhaps even suggesting questions for the public to ask, and be more out there with the information for doctors to make better use of, and the tactics that you were talking about before, Joseph, about how to not be wasting your time, because that's the other thing that kind of has put me off up until now. I just think I have to invest so much time to actually get my head around all this and be able to do it properly that it's, as Mara was saying, it's exhausting. Even just thinking about it, let alone actually doing it. I don't think I have anything else to add, but thank you very much, Mara. It's been a very interesting conversation and learning piece. I now have some work to go and do on social media. I mean.
Just one comment. Our Twitter girl, Veronica, she's having some trouble. As you say, as you're talking about social media, and sometimes you get upset that it doesn't work or connect us, so we're having one trouble now. But she said that she will manage. Well, we will try to manage, and even we can continue the conversation on Twitter. I try to be there for anyone that would like keep talking after we finish it. So Amber, you have more comments on Facebook?
Sorry, I couldn't find my window. Yes, so we have a comment from a lady named Joy, who's a GP registrar, and she said that social media can be a good avenue to sensitize the community about health issues affecting the communities we work with. And one good example I found about that was I met this guy who he works with for the World Health Organization with improving the use of toilets, because a lot of people in rural areas still use the outdoor toilet because using a toilet is not common for them, so they don't use it. And he said one thing you have to do if you want to increase the use of anything is to make it fashionable. So like I mentioned before, in my country, they use social media for a lot of things like HIV, AIDS, breast cancer, obesity, diabetes, male health, everything. And using social media kind of makes it fashionable to be involved in these community health services. So if you are not involved, it means that, oh, you don't have Facebook or you don't have Twitter, and so you're not up to date, you're not fashionable. And I think using social media as a way of making healthcare fashionable is one way of increasing the way that people think about their health. And then Smriti also added that in rural health, because a lot of the patients don't have technology, they come to the GP without a diagnosis, and because of that, they actually have a lot more trust and faith in the doctor because they can't research it themselves. So it's quite interesting to see the difference in an area where you don't have social media. They actually trust you more, and you have a stronger doctor-patient relationship than in the city where you have access to it and you will self-diagnose yourself. Yeah.
So internet and social media influence in our medical and patient relationship, and could make it greater or worse. I think it's kind of not a matter of greater or worse, but it's just point of view. Like I would like that my patients come empowered and knowing and having a lot of questions, as Luis said. It's kind of really interesting, and we can use it in their own favor for improving their own knowledge, and we can do an exchange in the consultation. Just to add more things, I really like the idea that the social media is an empowerment, and it's a health professional support, and I'm happy to listen that more people get stressed with trying to deal with social media, because it looks like everybody's perfect and are able to do 1,000 tweets, and well, maybe it's not so easy. And that is that. So Bianca would like to say something.
First of all, I don't have a Twitter, and I already struggle to deal with all social media that I have to deal with, Facebook, emails, and any others that I use. And but now, as Luis said before, that he just post the links of the guidelines on Twitter. So okay, maybe now it's time for me to have an account. But I was trying to hold it because I already have so much difficult to deal with all this information. Sometimes I feel that I'm suffocating, because it's so many information, so much information. But at the same time, it's really important. And another comment that I would like to say is that I have already read some articles about the fact that when the patient is empowered, and when the patient can search for his situation, his disease, whatever, it's easier for the doctor to explain, and it's the probability for the patient to get engaged in the treatment is higher. So I think this is another good point of people getting empowered and getting this chance to search for search about the disease and everything. And the last comment that I would like to say was about, I should have wrote it so I wouldn't forget. I think I forgot. I'm so sorry. If I remember, I come back if I remember.
That's fine. I just would like to bring two experience. I every week link it with all that we are talking. Every week I publish on a blog. It's in Portuguese, so maybe just Luis and Bianca can join it. But sometimes I try to translate in English, but it's kind of matter of time. But it's really interesting to get the people do not comment at all, but they said, "Oh, I read it," and it's kind of have some impact with the patients and with colleagues and all these kind of things. And I have a great experience in the middle of this year. I decided I was kind of upset with our health system, and I was upset about the empowering of people in our health system, so in the Brazilian health system. So I decided to do a series of movies with 3 chapters now, talking about our health system. It's called SUS, and it's become kind of like success. We have in 2 weeks 60,000 views. So it was like really great to have all the people discussing it in a mature way, because a lot of time we have people talking about the system but saying how it's bad and how it doesn't work and how everybody's on the hospital, but not a lot of people talk about primary care, which is another matter of social media. I think we are in primary care, we are trying to, with the time we are getting more and more space, and I think social media is one of the space that we are occupying very well. But a lot of people in Brazil still having the image of the good doctor is just a surgeon, and or curative models and this kind of things. and it was really grateful to have the social media to support my idea of discussing our health system in a great way. So just to share this experience. I don't know if anyone would like to comment more.
Yes, I would like just before to say congratulations for you and your friends, because the series is amazing. It's really good. It's really important, and I can make a link with what I forgot before. What I would say is that uh, here in Brazil we have a page on Facebook of our Minister of Health, and I started following it maybe a few weeks ago, and I started to pay attention on the images that this page was bringing to us, and I really think it's a really great tool because it's short messages with just important information, like pay attention if you start with this and that symptoms. Maybe you can have diabetes, maybe you may developing hypertension. Just short messages for people, and with lots of color and really colorful images, and images easy and that pay attention from people. I think it's really important. And also I would like to say that I have so I don't know if it was in Minister of Health, but maybe in the page of our Congress of National Health here in Brazil, they posted this series of SUS that Mayara just told us. And when I saw it, it was a national page, and I was like, oh my God, she got completely successful because it's already in our national page. So congratulations, it's a really good series. And this, I think, it's the most common or classic example that how social media can be a really good tool for us in health.
Yeah, I have to congratulate you, Mayara, because I've seen that series here in Portugal too. So it crossed the Atlantic. Yeah, so congratulations.
Okay, thank you so much.
Yeah, I've also tweeted a link to a page that has some nice projects that are ongoing. So projects that were planned and are being implemented by the Young Doctors movements, not only the Vasco da Gama movement, but also the other 6 of the Young Doctors movements across the world. You can actually find information on these projects, things like One Word for Family Medicine, FM Change Makers, IDM Daily News, the Aspire program. There is a calendar of events for so conferences all across the world. You can actually put them on the map as well. There are a link to publications made by young doctors all across the world as well. So you can find the link on our Twitter feed, and read more about that. And just to address the issue about not having time or enough time for social media that Bianca and Mayara have raised, I think it's important to follow some simple rules. So start small, start just using one network at a time. First just lurk around so to see what's going on, and then just start using it more frequently and being more proactive. And if you are using social media, for instance, for your practice, and you are building a page around it, have help, someone to help you with it. It can be a medical student, a trainee, whatever, but social media is about collaboration, and so have that in mind when doing it as well.
Yeah, a lot of people now is asking if...
add one comment from...
Yeah. Sure, Sarah, go ahead.
Oh, sorry, I just wanted to add one comment from the Facebook group. Smriti commented that in rural India there are a lot of quack doctors who are using social media to treat people and acting as if they were professionals. So even commented that that's why there needs to be more doctors on social media to kind of counteract that crack weaver. I just wanted to know what people felt about it, about fake doctors using social media.
Yeah, that's what I was mentioning earlier on. If patients are there and we are not there, then these snakes oil salesmen will be there. Pharma will be there to to feed information to the patients, and so that's why it's so important that we are there to feed them with accurate information that it's not commercially driven or else.
It's you, and I'd support that. I think that there's opportunities for people to make their own contributions through blogs, writing about their own interests. You don't have to be out there selling anything or selling yourself, but you could write some factual information about something you're passionate about, where people can find that. Big pharma with direct advertising to patients. Social media is going to be, and it already is, a massive opportunity for pharmacy, for pharmacological companies, for tobacco companies, for other companies to mass penetrate rural and isolated populations, and we have to be very conscious that we're not the only people that are interested in reaching people. There's an enormous market out there, and we have to be very conscious of that and how people can rapidly get the wrong messages about public health and their own health.
It's kind of war on social media now. We are the guys from the good side, and then we have the big guys from pharma. That's it's kind of this. Just to mention to everybody that we are going to the end of our program. So if anyone would like to do a comment, and we need to close now. So if anyone would like to add now, please, now is the time. And I will make more or three people will talk, and then we will close with each one talking. So who would like to talk now? Luis?
Yeah, I would just like to mention something that I think it was Sarah that mentioned it first, but we actually haven't gone through this because I think it was Sarah that mentioned about research and how social media could be used for research as well. And we have heard about Apple's research kit being developed and used in this sense, and I think there's a lot of potential in that. I guess that not that many people in rural areas have ever participated in a study, in a research study. So I think social media will also allow these people to participate in research studies, and the more generalizable these studies are, the best information we get from them. So it's also good that research is also going in this direction and using social media and smartphones to address these issues.
Okay. Anyone would like to do another comment?
That's you, and I just want to thank you all very much for the opportunity. It's been fantastic.
Okay, thank you, Dr. Ewing. You're very welcome. Another one? We can go, maybe.
I just would like to thank you all as well, once again, and I'm looking for the next one. And just one little comment. I am a little bit afraid to lose the links that Luis posts on Twitter. So Luis, if you don't mind, could you please put these links here or on Google Hangout, or maybe on our social media, our Facebook event, maybe. Thank you.
I'm looking forward with working with Mayara in having a Facebook page in the Social Media Ambassadors Network website for the Rural Cafe, and I hope we can have the videos, the calendar for the next events, and all these links there. So I hope Mayara agrees with this.
Okay.
But you'll have all the links, Bianca, one way or the other.
Yeah, well, we are trying to set a calendar and organize everything, and it's kind of I'm doing my interns. It's not an excuse, but it's being hard. So just to say sorry, but with time we are getting better and organized, and aren't we, Luis? Yeah. So maybe Amber.
Yeah, so I just, I think everything has really been said already, but I'm really glad to be a part of this, and I really enjoyed actually reading the comments on Facebook that have been running alongside this. And right now I'm on my hospital placement as well, and it has been difficult to try and manage life, but having the Rural Cafe really, it keeps inspiring me, and it's kind of a reminder of why I'm still, in medical school doing this madness. So thank you all for the opportunity.
I need to mention as well, just and after Joseph, but just to say that it reminds me here doing the cafe how I love rural, because I'm living just on the hospital in an urban area, and keep remind me how good was my experience on rural area, and looking forward to graduate and go to work. So it's kind of a good reminder. Sorry, Joseph, I
I
interrupted
just
you.
want to say that yeah, you are doing a great job. I just please keep it going. We'll help you if you need our help, but please just keep it going. Thank you.
Okay. Thank you.
Okay. So thank you all for this nice hangout. And just I wanted to summarize few things. The social media that can help in our public health programs is currently doing very good in India, and organizational promotion, patient care and patient education, also professional networking. And currently in India, we have got some floods in the southern part of India, and in disaster management also so social media is working very well. So overall, it's a great thing. Only we should be very much careful that whatever information which we give is genuine and it's correct and it's verified. That's what little bit of concern is there. But that we all family physicians can work on it, and we can make some content blogs on health related blogs which may provide some verified informations. That's all from my side. Thank you.
So, Sarah?
Well, thanks again, Mara, and everybody else, both on the World Cafe in whatever format that you're on it. It's great to have this use of social media and connecting with you all, and I look forward to next time. And I hope you all have a wonderful Christmas and New Year. And as I said, I'm not sure I'll be able to make January, but I'll look to see if I can, and otherwise look forward to the series next year. Thank you.
Yeah. So this is our last cafe, and thank you everybody, and have a good year. And I think we hopefully will be able to plan better for the next one. And Luis will help me, and Amber and everybody is doing a great job. And Veronica also, she wasn't able to participate, but she was bringing some insights to me on Twitter, what's going on Twitter. And thank you, everybody. And we can keep talking about it on Facebook, Twitter, and using our social media. Best for all, and bye.
Bye.
Bye.